Prostate cancer is one of the most common types of cancer among men. However, not all patients require active treatment. Dr. B is here to tell us all about what that entails. Welcome, Dr. B.
Good morning. How are you doing?
Good morning. You know, I'm good. So I know normally you talk about this stuff with Brad. You know, this is kind of one of those things that men talk about, you know, but it's not just a topic that men need to talk about. We as women need to talk about it too. We need to tell our husbands about it. We need to tell our brothers, our fathers, whoever it may be, because this is a big deal. This is a huge thing that affects so many people.
I completely agree. In fact, it's often the women that are the ones that are the advocates for these men. So I'm glad we're talking about it today.
Okay, so we're talking about something specific today. We're talking about active surveillance. Walk me through what that is.
Yes, it's a great question. So as you explained, not everyone needs an active treatment. And so what active surveillance is for men that choose not to undergo active treatment like surgery or radiation, that are being monitored closely through regular doctor visits, lab work, imaging. And so sometimes it even means repeating the biopsy again. So as you can see, it doesn't mean you're doing nothing. This is, you're actually doing something, active surveillance, but not doing actual treatment like the surgery or radiation.
Well, the name is basically what it is. You're watching it. Active surveillance. You're actively watching. You're actively being aware of what's happening. You're not just leaving it and hoping for the best, but you are still watching it. You're being very diligent.
Exactly. That's really key, because I think sometimes people feel like, oh, you don't need to do anything. That's fine. And that's really a big misconception. You really do have to be on top of it.
Absolutely. No, I love that. Okay, so who are candidates for active surveillance? Because this is maybe not something that everybody should be doing.
Exactly. So candidates for active surveillance are men who have a localized prostate cancer that have been categorized to have a fairly low risk of the cancer spreading outside the prostate.
Okay.
There are a variety of factors that determine that, including genetics, that can help us figure out who are the appropriate candidates.
Okay, all right, so I have a question on here that I want to make sure that I ask you in the correct way. So certain men, active surveillance can result in the same survival as for men who underwent surgery or radiation therapy. I mean, what does that mean exactly?
Excellent question. There was a study that was published this year where they studied men that underwent active surveillance versus active treatment. And you know, when you look at their long-term survival rates, they actually live just as long with undergoing active surveillance versus active treatment. However, there's a big catch.
Okay.
With active surveillance, you're being closely monitored, and so 75% of those men eventually ended up getting active treatment.
Oh, I see.
Yeah. So when you look at the two groups, the overall survival rates are the same only because they were being followed closely in that active surveillance group. Then eventually the majority did require an active treatment.
And that is a big percentage. 75% did eventually need that active treatment.
Yeah.
So why do the active surveillance then if you're most likely going to end up needing active treatment anyways?
That's a great question. And so the advantage of doing active surveillance is basically delaying the treatment and therefore delaying the potential side effects of the treatment, such as impotence or incontinence. And this is a big deal for many men that feel strongly about keeping their potency. So this can allow them to buy them more time, not having to worry about those potential devastating side effects.
I see. I see. And that, like you said, that is a big deal for a lot of men, and getting that time back, you're literally handing them time back in their lives where A, they don't have to worry about those side effects, and B, they don't have to be undergoing treatment, because I assume that undergoing treatment of any kind, that's taking a lot of your time, that's taking a lot of your mental energy, and so instead, you're watching it, you're staying on top of it, but you're not actually having to do the treatments right then.
Exactly.
Okay. And there is a percentage, I mean 25%, that maybe won't need any treatments at all.
Exactly. That's
all right.
Exactly.
All right. That's really great. Well, Dr. B, tell everybody who's watching where they can find you so they can come work with you.
Yeah. You can find us on our website, Prostate Cancer Institute of Arizona. The phone number is right there.
Love it.
Be glad to take your phone call.
And again, this is a segment for men because men need to know about this stuff, but women, we need to know about it as well because we need to be the ones sometimes to encourage the men in our lives to go take care of this. So, Doctor, thank you so much.